Welcome to India Lingua News. Our guest today is Amit Akkad. He is a director at ICC, Indian Council for Caring. This is a nonprofit group which really focuses on all types of well-beings for elders in the Indian American community here in the New England and also now around the country. And also, ICC is going to make a presentation about lifestyle program at upcoming Health Expo on 10th of April at Burlington Marriott. The expo is free, but you have to register. You can go to Indian England website and find the link there to register for free. And we are very much interested into this lifestyle program of ICC. And Amit is going to make about a 50-minute presentation at the expo. So before that, we thought we'll talk to him and know a little bit before the expo about what is the lifestyle program, what it consists of, and how successful it has been for the ICC. So Amit, welcome to our show, and thank you very much for our time. Your time.
Good to be with you. Good to be with you.
Go ahead. So let's first start with what is this lifestyle program which ICC is spearheading?
Yeah, so the lifestyle program is, as the name says, it is entirely focused on lifestyle to mitigate the risk of heart disease and diabetes among Indians. And it is focusing on 4 modalities of lifestyle, which is meditation, exercise, diet, and sleep. There is no medication involved at all. And the entire program is a 1-year program that is delivered on telehealth and using video and audio to a participant of the Indian community. And it lasts 1 year, and eventually after 1 year, it actually can last and would last for the lifetime. And I will give you more details as we go along.
So now tell me, so there is a big distinction, like of course, you know, the diabetes is very common among the Indians and Indian Americans. Heart disease is also very common among the Indians and South Asians. Do you have any data or any number you can talk about?
Yes. In fact, we have a lot of data. There is a lot of research going on for the past 20 years or so. And actually, I'm going to summarize some of the data at the presentation. But very quickly, if I were to tell you, Indians have 4 times the risk of diabetes compared to the white population among whom we live. They have 3 times more risk for heart disease among the people that compared to the white population. And also the heart disease actually occurs at a very early age among Indians. For example, among the heart disease occurs at about 25% of the people below the age of 50, and 50% of the people below the age of 60, which is actually only 5 and 10% among the white population. So significantly high number. And there's also a lot of data among, called specifically from a research called Masala study, which is the mediators of atherosclerosis among South Asians living in America. And I'll share some of the data there as well. So a lot of scientific data.
Okay. Now, of course, you know, the diabetes and heart disease are also the medicine, medical world is very much focused on them through medicines and etc. and physical care. Yeah. How your lifestyle differs from the medical care?
Yeah. So as we mentioned earlier, there is not only research on our risks for these 2 diseases, which is actually an epidemic, but there is also a lot of research available which shows with a significant data that the lifestyle can actually significantly change the risk for heart disease and diabetes. And in some cases, or in fact, in many cases, people who have subscribed to the lifestyle program, they have actually reversed the diabetes. In fact, they have stopped taking medications because their hemoglobin A1C level, for example, has gone down. Their insulin level has improved significantly. So because there is a proven scientific data that shows that we can mitigate these risks, And that is the reason why these programs were started, saying we don't necessarily need to take medications, because with medications, there are side effects as well. But with lifestyle, we have a significant benefit, not only for these two diseases, but as we all know, it has a significant improvement effect on other diseases as well. So it's a plus in all directions.
So now we are looking forward to listening to you at the expo. But is it possible, and just, I'm curious, can you give some sort of insights about the 4 pillars you talked about lifestyle?
Oh, yeah. Yeah, I mean, most people know about all the 4, right? Meditation, diet, exercise, and sleep. And what happens is that most of whenever I do these presentations, by the way, I've done 40 of these presentations in New England. And we have talked to more than 1,000 people. We have 120 plus people who have joined this program. But there is a simple question that always comes through. What is unique about this? What is unique about this lifestyle program? Because you can go on internet and do the search on meditation and certain diet and all of that, and we get millions of answers and so on and so forth. What is unique is that your risk is different from my risk, and everybody else's risk is different. So one of the most important things needs to be done is to specifically measure the risk for each and individual person. And once that is done, which is what this program does, by the way, it goes significantly into the advanced markers that most people don't even know. In fact, most of the doctors don't know the advanced markers because they are specifically indicative of the risk among Indians. So those are the risk assessments that are done, and then the customized approach for these, for each individual is done with respect to meditation, diet, exercise, and sleep. And what happens is that once this customized recommendation is made, then there is a specific focus with a heart health coach, which is what this program does. They assign you a coach if you join the program. I have a coach, for example, and the coach actually goes through specific recommendations around meditation, around diet, around exercise, and around sleep. So they actually give you advice specifically around what kind of diet is going to be helpful to you, not a generic recommendation, to you based on your particular risk. So that is when, through the heart health coach, we get into significant discussions around these 4 modalities.
Now, how the program works with the ICC? Like, you have to enroll in a program or course, or how many courses you have to do? How it works, if you can just...
Yeah, so the program works this way. You go to the website and sign up for the program. And once you sign up for the program, you'll get a call and there will be an assessment done. So the program is in 3 phases. The first phase is assessment. So when I joined up, I got a call from the Lifestyle Center asking me all the questions about my lifestyle, about what kind of food do I eat, how much exercise do I do, how much sleep do I have, et cetera, et cetera. And then they send me a prescription. And the prescription I go to a Quest Diagnostics, which is almost in every town in the United States. And through the prescription, there are a lot of emerging markers that get measured. For example, lipoprotein A, which is a genetic marker. Nobody ever tests for that. No cardiologist ever tests for that. And because for white population, that is not required. For us, it is required. They measure the LDL particle size, for example. They measure CRP levels, etc. And of course, I'll talk about all these details. But once that is all done, then after I give my blood test, within a week or 2, I get a report. And then the coach talks about my report with me about what are my risks. And within that report, there is a recommendation around these 4 modalities, right? What should I do about meditation, like exercise, sleep, etc. And once that is done, then they educate me as to why they are telling me that, because this is a science-based program. This is not opinions. So then I go through webinars. They set up webinars. I go through webinars. What happens to nitrogen level, for example, when I do meditation, right? So that tells me why should I do certain things that they are asking me to do, because it is going to improve or reduce my risk for these 2 diseases. And once that is done, then they assign a coach. So the first phase was the assessment. The second phase was the education and intervention. And now I get a coach, and I have monthly sessions with a coach for 1 year, where I go through all kinds of questions. For example, I said, I don't like to eat fruits, even though he are recommending me to eat fruits, right? What can I do? And the coach solves the problem for me. The coach becomes my guide, coach becomes my friend. So there is a monthly session with the coach, sometimes with the dietitian also. So they nudge me, they help me to implement the lifestyle recommendations that were given.
So now, is there any fee for this?
Yeah, so what happens, I know you are familiar with ICC. ICC
Sure,
does
I know it's a non,
right,
sure.
and we never charge any fees for anything whatsoever. So what happened was that we decided that we would provide this service to the community. So we have a significant expense in doing that. But we also said that if we give it completely for free, then people will not find any value. So we decided that we will at least charge a small fee for that, even though we are raising a lot of money to cover 90% of our expenses. But in order to cover at least 10%, we are charging. So there is a one-time only fee, which includes prescription and blood tests and everything. So there is a one-time fee of $299, but that's it. There's nothing else.
Excellent. So I think that we are looking forward to learning more at the expo, and we will see you then.
All right, I'm definitely anticipating a lot of people joining the INE Health Expo and talking to us about this program. And thank you very much, Upendra.
Excellent. Thank